Yeah, we'll go ahead and get started. For anybody who doesn't know me, my name is Grant Parker. I'm the head of marketing for Flume Health. We're a fully transparent, tech-forward third-party administrator. I'm joined by Bryan Bickley, who is a Health Rosetta advisor and a very good friend of Flume with Scott Insurance in Raleigh. Bryan, how are you?
I'm doing great, thank you.
Great. Well, I mean, the reason that we're here today, Bryan, you and I began working together only a year ago, but we've built a very strong partnership already. We took our first group live together in September and then two more in January. And what I really want to talk about is partnership. When you and I first got introduced, you had all these ideas for what you wanted to do for a group we're going to talk about today called Talbert Building Supplies. And I actually remember you saying to me, I haven't been able to find a partner who can help me do the things that I wanted to do. So to us at Flume, real partnership is very important. That's what the audience poll is all about. I would like to know, just as a starting point, what do you as my audience look for in a TPA? Some advisors, they just want numbers for a spreadsheet. Some have had really bad experiences with TPAs or running independent plans, taking their clients self-funding, and they want to make sure that they don't get burned. But I hear a lot nowadays when I'm talking to advisors that what they're really looking for is a partner to bring groups forward and say, hey, what can we do together?
And a little advertisement, Grant, for Health Rosetta. There's now Excel and Inside that will help you speed the process in terms of finding partners. So I definitely a shout out to them.
Nice. Okay. Health Rosetta, Excel, and what was the other one?
Inside. Yeah.
Excel and Inside. Yeah. And Flume is Flume is one of the integrated TPAs. I think we're one of two integrated TPAs. So you should probably run into our name if you run down those tracks. So let's get started. We're going to use a group as a case study called Talbert Building Supplies. And I want to kind of lay the groundwork about what that group is like. So this is a group that you and I worked on putting the whole thing together. So Bryan, tell us about Talbert Building Supplies.
Yeah, Talbert Building Supply. It's a great little family-owned third-generation company. They've got 4 locations, North Carolina and Virginia. And they were working with the traditional kind of small town advisor. And they had been through the fully insured renewal with, every carrier you can name.
Okay. Yeah. Kind of that frog slowly boiling in water type situation.
That's right.
I think you said to me. And so how did you get introduced to them?
I was actually introduced. One of Dave's books talked about economic development and how healthcare really was an economic development issue. And so I started calling around. If you go outside of Raleigh about 45 minutes, it's relatively rural, and just having conversations with economic development folks. And it just so happened I connected a nice relationship with a guy in this county that's just above Durham, actually. And he happens to be a property and casualty broker in his real day job. And he referred me into Talbert.
Okay, so pursuing that kind of economic development in the area, because I know that there's a community health plan aspect to Talbert and to like this kind of larger project. Can you tell us more about what's going on in that area?
Yeah, it's just north of Durham, and for those of you who don't know, Durham, North Carolina is nicknamed the City of Medicine, and so there's enough business owners of medium to larger sized businesses in the areas around those communities. And the great thing is there's still independent providers who want to stay independent. And they literally say, we don't want people driving to the City of Medicine to access their health care. So we're building a little coalition in this community. It's, like I said, kind of a small town, and it's been great. Sorry about that.
No problem. No problem. Okay, so you're building the coalition in the town. This is kind of a larger ongoing process or project that you're working on.
Exactly.
That's great. Very fun.
No, I think it's the session background music.
The session is background music?
Maybe Sarah can help with that.
No. Yeah, maybe Sarah can turn that off. I don't know what to do there. Sarah, do you have any idea what we can do about music? All right, well, I guess continue moving forward with it. So Bryan, one of the things I want to talk about with damn, he just left out. All right, so we'll figure that out. The information about Talbert that I thought that was most interesting when we were looking at it as a group, and I guess I'll kind of cover for Bryan until he pops back in here, was that there were a couple of very glaring issues that Talbert was having about their plan. So first and foremost is they were facing a really high increase, 30%, a 30% increase with Aetna. And like he said, they'd been with a bunch of other sort of BUCA plans in the past, just hopping from one to the next. And the bulk of that increase was based on a specialty medication for Crohn's disease, so either Stelara or Cimzia. And they had only 3 members on a plan of 130 that were taking this drug. But that is what was driving a 30% increase. And it was about $300,000 or $400,000, the cost of just the drug. And I know that Lynn, the CFO, had been talking to Bryan and saying, look, I don't want to spread this increase over the entire group. You've been talking to me about transparent plan design. What can we do? Hey, you're back.
Sorry about that.
No problem. I was just talking about how they had that really high drug cost, and Lynn had said, look, I don't want to spread this over the entire employee population. And so my next question for you was going to be, how and when did Flume get involved as a partner on this case?
Yeah, well, this whole thing happened quickly. I mean, we were introduced to Lynn, and I think she got a renewal about 2 months after we talked, and we talked about, I wanted to be kind of memorable and talk about, what we were doing and what we were passionate about. And
Yeah.
Lynn crinkled up her forehead, the CFO, I'm sorry, an HR person crinkled up their forehead a little bit, but said, that's interesting, as opposed to, shutting the door on us. And so when she called me back, the way she referred it back to me was kind of fun. She said, I remember you talking about blowing up our health plan. And so she's like, I think I'm ready to blow it up. So she had gotten 30% renewal.
Yeah.
And Flume was actually involved even before that, because we were fortunate enough to have some claims information. And I think it was a family-owned kind of tight community. So I know Lynn and the HR person knew that there was some Crohn's disease going on. So, we were fortunate enough to have a little bit of information that we could create something kind of tangible for them, to not say that this is a definite, but we think there's some room here for improvement.
Yeah. Well, and so in speaking of improvement, I think that's kind of the name of the game of this group. And that's another big thing that you're kind of looking to Flume for as the group progresses. Like, the vision is to continually improve the plan design. What part is Flume Health playing in sort of the long-term strategy here?
Yeah, well, in the beginning, I think it was comforting for the group to understand sort of the crawl, walk, run, and we sort of chose the walk, methodology. But absolutely, we're relying on Flume to to help us analyze the data and make recommendations going forward. And I think one huge takeaway for me is that we've had such good experience in the beginning. And what I mean by that, financial, certainly great experience financially, but such great experience for the employees. And Lynn is getting this feedback from her employees. We're getting thank you notes from the employees. And I think that's just giving the group more confidence to go, okay, let's continually improve. This thing is working, and it's got some it's got more room to go, but she now has the confidence because she's getting great feedback.
Yeah, and this is about watching the data of the plan on a regular basis, engaging with members, but also bringing back to you saying, hey, we're seeing this pattern, we're seeing this trend and this utilization. For next year, we should think about some changes or some improvements.
Absolutely.
And so, the interesting thing to me about the plan design is that it really is designed to have some open gaps there, right? Like, we put them in with a pretty easy to run, easy to use, independent self-funded plan. We put them in with First Health as the network so that people could have a network that they were really feeling good about. First Health is flexible enough to let us integrate medical management. So we used AIM and Sano Surgery to start looking for alternative options anytime somebody does have a large procedure. But there's room to say, after we have a year of data, let's add maybe some chronic disease partners. Let's bring in a couple of other point solutions that are going to specifically fit the needs of the group. And then one of the things that I want to kind of zoom in a little bit on is about the pharmacy piece, because I think the group had a really big pharmacy need. And so with Flume kind of looking at Health Rosetta type plans, you need flexibility. You need to be able to put a lot of pieces together. That's kind of where Flume fits in, integrating all of the pieces in the stack, and then creating this interface one-on-one right with the members, where to them, it doesn't look confusing. It doesn't feel complicated. There's one phone number to call. It's written on the ID card. It's everywhere. And they can get access to all the pieces of the plan without having to call around for it. And so what we did when we were underwriting this group was specifically looking at, there's a drug problem. The group knew that they had a problem paying for drugs. And you were actually incredibly good. We're talking about partnerships. You were incredibly good at giving us the data that we needed to get good stop loss quotes and provide them good numbers. How did you get that data? What did that look like on your end?
Yeah, well, we were sort of fortunate on that front that they'd moved around different fully insured carriers. They were actually with Aetna, and Aetna does provide some data. Like I said, I think the CFO would have made a move because we had enough just anecdotal evidence, but it was nice to have some aggregate data to help with the stop loss numbers and making those decent.
So what we were able to do on our side was we shopped it out for stop loss. We presented a couple of options kind of side by side and said, look, you can take as big or small a step as you want. Here's the numbers. But we were also able to look through all of the data and specifically say, we see a lot of savings on the pharmacy. So you have 3 people who have Crohn's disease. They're taking Stelara and Cimzia. There's savings on the table. It's not going to show up in your underwriting. Like the underwriters aren't going to take it into consideration, but we think there's even more savings possible. And it kind of allowed Lynn and the team to take a little bit of an informed risk, right? And say, okay, there's savings, but I think if we actually choose to go down this pathway, there's more savings than is on the paper. And what that kind of let us do is look forward and project for them. And I remember having this conversation with them, over the next 5 years, here's what it's going to look like if you don't make a change. Here's what it's going to look like if you do make a change. And then I think you quoted a number to me the other day. How is the plan running so far?
Well, if you go back to the renewal, we're actually about 45% underneath the renewal. So they're, about $350,000 just on the pharmacy piece alone, which is great. But we're about 16% below the projection, the mature first year projection.
And a lot of that savings is that specialty pharmacy piece, right?
That's right.
So I wanted to build that into the plan here because I get a lot of questions about it. So just to talk about the member experience when there is a specialty pharmacy partner involved in the plan, this is on screen right now, kind of what the member would have been experiencing. They're filling their prescription with Aetna. They're buying it through their drug shop. It's costing about $22,000 for the plan every fill. And then the member, of course, has their amount they have to pay. So it's about 500 until they hit their max. The way that this program works is essentially Flume came in. We started looking at all kinds of PBMs, all kinds of partners who could specifically offer the best solutions for Stelara and Cimzia sourcing. We wound up going with a partner called Script Sourcing, which essentially lays on and works with APRA, which is the PBM. And the way that it works for the member is we were just watching the claims come through. We didn't know who this last member was that was on Stelara. We just knew they were out there somewhere. So as soon as we saw the claim come into the system for Stelara, the Flume concierge goes into action. They reach out to the member. The member knows Flume. We're on their ID card. We just ran their open enrollment. It's easy for them to take that call. It's not a stranger calling. We kind of make the warm handoff or the handshake with Script Sourcing. And then from there, Script Sourcing is carrying that member through the application process. You have tax IDs and paperwork and things like that. All three were, they were accepted into the Manufacturer's Assistance Program, which means that Stelara is off the drug formulary for the plan. And instead, that patient's getting the drug right from the manufacturer, and Script Sourcing sort of sits in the middle and adjudicates that relationship. So the patient's receiving it shipped directly to them, just like before. They're not paying anything. It's completely free to the member. And the plan is paying a small fee to Script Sourcing to kind of keep that relationship going. So the member's experience is, you apply once, and then from there, it's just like you've been getting your drug before. But the plan is saving a ton of money on the drug, and so is the member. And I think we're coming close to time here. I'll be in the Flume booth if anybody wants to talk. But the last thing I wanted to talk about is, and we'll stay over because it doesn't look like people are leaving right now. There were things that we are doing, Bryan, you and me and our teams, partnering on member communications. So can you talk about the relationship and the things that we kind of partnered with for this, and then also for another group that we have called Arcadia?
Yeah. Well, I think, it's been mentioned during the summit several times. I mean, just to be able to work with a real partner. Arcadia has a fantastic culture already, and they really worked hard and wanted to explain the why they're, moving down this path. They are really focused, and they've read Dave's books, and they're really they're all in, which is exciting. The leadership team. And so they're very focused on a healthcare dividend and applying that back to offset and to help on other social determinants of health. We're working with a local physician in that community who actually has attended part of the summit as well. And so that's super exciting just to have a team. Flume has professional communication and marketing people that have helped and have been in on those original conversations. So that's been great.
Yeah, I think setting up that I'm looking forward to kind of building that program out. I think a lot of the things we used to educate the Arcadia leadership team just on how the system works is we're just going to be able to one-to-one show that to the members and start teaching them as well.
Yeah, and it's exciting when even the leadership team wants to teach their employees what's wrong with the current system. Yeah, and explain to them why I think there's a lot of employees think, why are you making me go through this just so you can save costs and make me jump through more hoops? And to really explain, no, it's actually about you. And our goal is to help improve your life and reduce costs for you and get you better care. So it's been great.
Well, I think we're at the end here. I wanted to ask you, Bryan, partnership, that's the word for this presentation and kind of for this show. What does it mean to you? What does it mean to you to have a good partner in these groups?
Well, I mean, I've been doing this for 20 some years, and it's a different, and this has been talked about during the summit as well, but it's just a very different relationship with people like Flume. We're all getting paid, I think, in an aligned way. And we all have the mission to help the employer and their employees. and it's just refreshing and great.
Yeah, I've loved it as well.
Peace
Yeah,
of mind, and really, this is my passion, and it's nice to work with people who feel the same way.
that's why I like Health Rosetta. That's why I keep coming back. I think we're swimming in the same pond.
Yeah, definitely.
Well, I mean, there's a lot of people still in here, even though we're over time. If anybody has any questions, or for me or for Bryan, please feel free to type it in the chat. We'll hang out here for a few minutes. Otherwise, you can come by the Flume booth. We are giving away Bitcoin. People keep asking if I'm joking with that. That's a real giveaway. You can win a lot of money. Please go to the Flume booth and sign up.
Thank you, Grant.
Yeah, absolutely. Thank you, Bryan. This has been so fun. All right, I have a question here. How does Flume get paid? Flume is very, very about transparency. We get paid on a flat PEPM fee. We don't have any VIGs, we don't have any kickbacks, we don't have any exclusivities. We're paid up front. Everything else is passed through to the client. Beth asks about how are we using primary care in this plan. I think that's in the plan for the future, right, Bryan?
Yes, that's definitely in the future. We're definitely looking at it, and that's the next one of our main primary next steps. Absolutely, and all three clients we're talking about. But we've already engaged physicians, and we're already having conversations about that. So we're getting there.
Yeah, and I think a big question for this group is just about the location and where would be the right provider for them and things like that, right?
Right. That's right.
Yeah, absolutely. So we're collecting group data right now. They're getting used to the plan, and then that'll be part phase 2.
That's right.
Gordon, yeah, 100% revenue comes from the employer, 100%. Sean Dalber asked, was the script sourcing voluntary for the member or mandatory? Presumably voluntary.
Yeah, it was voluntary with a financial incentive, certainly for the employee to lower their out-of-pocket costs to zero.
Yeah. So the way that it looked is, Bryan, to go a little bit deeper. There were 3 people taking the drug. We knew who 2 of them were. So before the plan even started, Lynn and the team had approached both of the people that they knew and were able to explain, at the table, hey, we found a way to order this exact same drug, essentially wholesale rather than retail. Your cost is going to go to 0 if you pursue this. And so when you can tell a member your cost is going to go from $2,000 a year, because that was their max out of pocket, to $0, that's a very, very good incentive. Awesome. And then, like I said, the third person, we did not know who they were. We were just watching the claims. That's Flume's job. So our system is always watching claims as they're going through and pre-certs. We're looking for opportunities to get involved. We were messaging during open enrollment saying, hey, if you are taking any kind of high cost medication, we may be able to get it for you cheaper. Please come forward. We included in a lot of member education pieces as well. Very good question. Anybody with Joey Bickley hasn't looked for you on his ancestry.com.
I know, that's funny.
Any last questions from anybody? Bryan, I'm afraid I'm holding you up.
No, I'm gonna head back over to the stage, but thank you very much.
Yeah, this has been great. You can feel free to bounce out, Bryan. Gordon, yes, it is our claims adjudication system. It's one that we bought, and then we have built a lot of technology on top of it. So we're using a claim system called Javelina. It's essentially the leading product in its class. And then what Flume has done is we've invested a lot of time and a lot of money and a lot of years building technology on top of it. If you go to our booth and sign up for a demo, I can show you what it looks like on the back end and how it interacts with members. But essentially, it's been augmented in a way so that the system is very smart. It can read claims. It knows what's coming into it. It knows how to sort them. And it knows to, for example, see a J-code claim for Stelara and throw up a flag and say, hey, we got an opportunity here for savings. And so the system is doing that over and over. And then we, the human team on Flume, are taking those alerts, connecting with the members, and actually making that change. So it's a much more proactive way of managing the plan rather than just taking in claims and paying them. I will, I know it takes like a minute to write questions, so I'll just pause here awkwardly. Use Javelina, meaning it's not your claims system, correct? We did not create a claims system from scratch. I don't know of any TPA that has done that or would have done that. The Javelina claims processing system, you know, when we went through our RFP process for that, it is the industry leader. It is the best in class technology. So we did not create a claims processing engine from scratch. It's called Javelina. And that makes it possible for us to trade data and to have trading relationships with other vendors. So integrating medical management, PBM, all of those things are already set up to integrate with these systems. And so that's why it's actually better not to kind of build your own from scratch. We wouldn't be able to partner with as many pieces of the stack as we can. Gordon, next question. Who is the best repricer for RVPs? You know, if you ask me or if you ask us, it's not necessarily about the best. It's really about what's the best for the client, right? We have clients with 6 degrees. We have clients with other repricers. And there's lots of reasons why one repricer might be better for a certain client than another. It could have to do with their geography. It could be the way that they want to set up their plan. So, you know, just like we did with script sourcing, we didn't just stick script sourcing into this plan. We said, okay, we need Stellara and Cimzia. What's the partner that's going to get that for us the best? Who's going to have the best prices, the best member experience? And we shopped it around. So we'll do the same for all of the vendors of the stack. We have partners we go to on a regular basis, but it is very much about what's the best way to build the plan for this particular group. Here's a question. Are there any SLAs for the call center employees and providers? Yes, absolutely. I mean, there's SLAs for call response. There's SLAs for call return. There's SLAs around balance billing advocacy. So that wasn't something we talked about here, but Flume was built to have very, very strong balance bill advocacy processes in place. So there's a lot of SLAs specifically around that about doing outreach to the providers to try to adjudicate the balance bill, how many times, what's the cadence, things like that. There's SLAs in place about keeping the member informed about what's going on. When, you know, we have RBP groups, and so we do a lot of direct contracting. We create what's called Flume Community around members, where we have direct contract with providers in their area. And there's even SLAs around the outbound efforts to build direct contracts and to get providers to sign those direct contracts. So yeah, it's all built into the plan. And there's a question about data analytics. Yeah, this is something that Bryan was talking about a little bit about the data piece. So think about it in 2 ways. One is there's raw data. So the raw data is made available through a platform called PlanWatch. If you've heard of Springbuck or anything, it's exactly the same. It's an online portal. The claims are updated every week. You as the advisor and the employer have a login. You can go and look at as much raw data as you want. You can drill down. You can see a level of detail, you know, above and beyond, certainly above and beyond carrier reports. So you have access 24/7 to claims that you can drill down into the raw data. And then what Flume is also doing, and this is what Bryan was talking about, is we are providing more like analysis and insight. And so on a monthly basis, there's reporting, and then especially at the half year and the and around renewal time, Flume is looking at trends. We're seeing how things have been going. We're seeing, you know, oh, we're seeing a lot of visits to this office. Let's, you know, try and get direct contracts there. Or we're seeing a lot of access issues, maybe a different network, something like that. And so we're going to be watching the plan, and we're going to be able to provide essentially recommendations or guidance on ways to improve the plan the next year. So there's raw, and there's sort of data interpretation that we're providing. And then there's another question. do you charge for employers to use Flume's direct contracts, assuming Flume owns those agreements? No, definitely not. I mean, Flume community is what is how we categorize the direct contracts. Those are part of any Flume plan. So if you are on a plan with Flume and you're in a network environment that allows access to direct contracted providers, for example, Cigna does not, but First Health does, and certainly a reference-based pricing does, you have access to any Flume community providers. So that's a really great feature when it comes to creating community change and sort of community local health plans. Is Talbert has direct contracts that we're building around where they live. The company down the street from Talbert, if they came on Flume, would have access to all of those contracts that were already built. It's not based on the employer, it's based on Flume. And so what you can do is you can start to create this flywheel where the more employers in an area are being administered by Flume, the more access each of them has to direct contracted providers. You guys are great in helping me. Why do we need direct contracts? That sounds like a question about sort of the philosophy behind direct contracting in general, which I'm more than happy to talk to you about. I mean, I would probably actually ask a little bit follow-up question because I don't want to explain the value of direct contracting to somebody that already knows what they're talking about. But Gordon, I don't know if you want to turn your camera on, you can come on stage and we can absolutely talk. Or if you want to meet in the Flume Health booth, if you want to come on stage, we can actually just talk about it. Rich, are you getting any stop loss decrements for clients using your full list of cost management programs? Yeah, absolutely. That list grows longer. It seems like every month, every quarter, of stop loss partners who know our book of business, understand how we do what we do, and are writing us decrements down. So it's not all of it. When we go out to market, we will, we'll talk to 13, 15 different carriers, usually in coordination with the broker, so it's not kind of all over the road. But there are certain partners of ours who understand our book and are writing us down decrements, certainly. Yeah, Gordon, absolutely. I'm going to take a note. I'll follow up with you. Again, I have answers to your questions, but I want to make sure I know what the question is. I don't want to tell you stuff that you already know. Cool. Any other questions? There's still 10 people in here, and I'm more than happy to hang out for as long as anybody wants. But also, I will say this, if you do go to the Flume Health booth, there's a guy there named Kevin Schlattman who's actually a genius and who knows way more about this than I ever will. He's the one who taught me. So you can go there and ask him your questions and get way smarter answers than I can give. All right, well, that's it. I will cut this off. Thank you so much, everybody, for coming. This was incredible. We way overshot our time. I love that. Everybody have a really great day, a really great weekend, and thank you so much for coming to the conference.